Hello homies, welcome to our YouTube channel where we teach you about type 1 diabetes. My name is Caitlin, your type 1 tour guide behind the cameras, and my partner in crime. In today's video, we're going to be talking about hypoglycemia. So without further ado, let's get to it. So hypoglycemia is when your sugar is really low. And by low, I mean like not 70, which is actually considered low, but I'm talking like super low, like more in the 50s and the 40s. So at that point in time, it's really important that you correct that. You need to make sure that you raise your sugar in some type of way. That way you don't go super low and have a chance of passing out. So the symptoms that I experience when I'm getting low, I actually experience a lot more of them than when I'm getting high. So I start to shake. My hands start to shake mainly, but you can also kind of feel it, like all over your body, like you're just trembling a little bit. And that's like the biggest giveaway for me that my sugar's getting low, because it's something that catches my attention immediately. A couple other things, I get super hot. So I feel like I'm burning up. All of a sudden, no matter what I'm wearing, no matter where I am, I get really hot. And that's something that lets me know that I should probably check my sugar, which is something you need to do. Don't just think that your sugar is low just because you're experiencing a symptom. Make sure you go ahead and check your sugar to make sure, because you don't want to raise your sugar if it's in a good spot. Another thing that happens to me is my vision sometimes gets a little blurry, or almost like when you walk out of a movie theater, how that light kind of hits you. That's kind of what happens to me. So it's kind of like a white light. I don't lose my vision completely, but it's just a little spotty, which shows me that, I should probably sit down and check my sugar. One that I normally don't notice, but the people around me notice, are I get super like funny and giddy and kind of like comical. So I start cracking jokes. I start acting like really fidgety and like kind of like I'm bouncing off the walls, like I've had a lot of caffeine. That's something that is a symptom of mine, but a sign that other people notice. So they can let me know, you're getting a little crazy and it's time for you to check your sugar. So when you notice that you are having low blood sugar and you've tested to make sure that your blood sugar is actually low, there's quite a few things that can actually help bring your blood sugar up. So the first thing you need to do is stop giving yourself insulin. When you eat something, you feel the need to give yourself insulin. But when you eat to bring your blood sugar up, you don't give yourself insulin, because that would just counter what you're doing. So you eat something, drink something, but leave it alone. Don't do any type of insulin or correction or anything like that. You're going to want to eat something, and in 15 minutes, you're going to want to check it again. It's called the 15-15 rule. Eat or drink something that's 15 carbs, and then check again. So the few of the go-tos that I have are, first, like juice boxes. I always keep at least 1 or 2 juice boxes of any sort with me. I believe that Capri Suns are a little less than 15, but most of the time they do the trick, because liquid goes through your system a lot faster and a lot easier than something like candy. So I use the juice boxes the most often. But another liquid that's pretty easy is honey. So I keep these honey sticks in my bag. They're really convenient. All you have to do is bite the top off or cut the top off. So normally 2 or 3 of these will do the trick. There's also like gluco tabs or like gluco gel, which the gluco gel, you just like squirt the tube into your mouth and swallow it, and it helps bring it up. It's just it's like pure glucose in like a gel form, and these are glucose in tablets. So I think like 3 or 4 of these do the job. These are convenient for like sports. If my sugar is low, I just take 1 or 2 and pop in my mouth at a time, and that's something I can do as I'm on the go. There's also other things that you can do to bring that up, like a hard candy or drinking like regular Sprite, like a regular soda. Most of the time, it's important to stay away from things like chocolates and candies, because you don't want to take something or eat something that will raise your blood sugar but is bad for your diabetes. So something like the tablets and the honey that will get your blood sugar up but is also not super bad for you is the best way to go in that situation. If you notice that your blood sugar is constantly low, which is something that happened with me, you need to let your doctor know. So I actually noticed that every time I ate lunch, I would give myself the right amount of insulin, and then my sugar would drop super low. So I actually sent my doctor an email and said, hey, I'm getting kind of worried because my sugar is super low. and it was getting to the point where it was getting in like the 50s, which is super scary to a new diabetic. So what happened was my numbers were wrong. They had given me too much insulin for the amount of carbs. So they changed those numbers, and now when I take insulin, it doesn't go low nearly as often. So make sure you're communicating with trusted adults like your parents and your doctors if you notice that every time you take insulin it's going low. But if it's just the occasional occurrence, then the things like the juice boxes, the glucose tabs, the honey, that will help you. So that's it for today's video. Let us know if you all have any questions about anything that we talked about, but more importantly, if you have a serious question, reach out to your doctor or endocrinologist about that so that they can give you the next steps. Until next time, homies.